myself Saloni Shetty. I'm working as assistant professor in Yenepoya Physiotherapy College. Today we are going to see about the topic applied science of exercise and techniques. Moving on to the specific learning objective. At the end of this chapter, student will know what is range of motion and its types, its indication, goals, limitations as well, and the precautions and contraindications to be taken before applying range of motion exercise and while applying range of motion exercise, about the principles and procedures of range of motion exercises, and at the last about the self-assisted range of motion exercise. These are the contents of today's topic. Moving on to the introduction of range of motion. Now basically it is a basic technique used for examination of the movement as well as for initiation of the movement while we give a therapeutic intervention. That is, before giving the therapeutic intervention, it is used as an assessment scale, that is for examination of how much is the movement in the patient, whereas once we know that, we initiate that particular movement as a therapeutic program. So that is initiating a movement into a therapeutic intervention. Now basically range of motion is not only about how well the bones are moving or the joints are moving, it's also about the structural integrity and the flexibility of soft tissues. Now these soft tissues include everything, that is not only the bones or the joints, that includes the muscle surrounding that particular joint, it includes the nerves, the blood vessels, the fascia, everything which surrounds that particular joint which we are supposed to move. And all of these affects the amount of how much is the motion in that particular joint between any two bones or three bones. Now the full motion possible is also called as range of motion. Now as I already mentioned, when moving a segment through its range of motion, all the structures which are involved, that is muscles, joint surface, capsules, ligament, fascia, the vessels and the nerves. Now this range of motion exercise is not only the joint range but also the muscle range. Now if I am moving my wrist like this, it's not only involved with my wrist, it also involves the muscle range. That muscle range is also called as functional exertion of muscles, that is range of muscle. Now it's the ability of that particular muscle or the capacity of that particular muscle in order to shorten if once elongated to its maximum. So if I am doing elbow extension, if that's elongated to the maximum, the ability of it to shorten it back and to come back to the basic position is the functional exertion of that particular muscle. Now moving on to the topic, that is types of range of motion exercise, which are basically passive, active and active assisted. Now before we see the definition, in general terms, active range of motion is nothing but if I am doing my wrist into flexion and wrist into extension, this I am doing by myself. So these are called as active range of motion exercise or active movements. That is, I am doing flexion, I am doing extension by myself. Whereas if this particular hand or this particular wrist is not moving into flexion extension, I might need my physiotherapist or some external assistance to take this into flexion and extension. That is, somebody else will come and move this into flexion as well as extension. So this becomes passive movement, that is external forces doing this particular movement. Whereas active assistive, if imagine I am able to do it this much but not complete till here. So this much the patient can do by himself or some of your client can do, whereas the other half I will take assistance and complete that particular motion, that is active assistance. Now active assistance can be done by mechanical force as well as a manual force as well. So we'll see the definition now. That's passive range of motion is the movement of the segment within the unrestricted range of motion that is produced entirely by an external force, that is complete external force, and there is no or little voluntary muscle contraction. Whereas active range of motion exercise is the movement of a segment within the unrestricted range of motion that is completely produced by the active contraction of the muscles crossing that particular joint. Whereas active assistive is a type of range of motion where assistance is provided manually or mechanically, any of these, by an outside force, because the primer mover, that is the prime mover of the muscle or that particular joint, needs assistance to complete that particular range of motion or that particular motion. Now let's see the indications of passive range of motion first. Now in the case where there is acute or inflamed tissue, we give passive range of motion. In the cases where the patient is not able to do or they are not supposed to move a joint actively, that is in the case where it is prescribed immobilization, In those cases, passive range of motion can help, and after surgical repair of a contractile tissue, basically we do passive range of motion exercises initially. And then to see the goals of passive range of motion, it decreases the complications that would occur because of immobilization. Now, immobilization as such has many adverse effect. That is, if you're not moving a particular joint or particular limb for some weeks or months or some years also, if I say in some conditions, so that will have lot of adverse effect. Maybe contracture will happen, or the flexibility will reduce, or the blood circulation will reduce, or the dynamics of the movement will reduce. Now, all of these complications can be reduced or decreased because of giving the passive range of motion exercise. To maintain the joint and connective tissue mobility also, passive range of motion helps in order to minimize the effect of the formation of contracture. That is, because of immobilization, any contracture is happening means we can give passive range of motion, and that prevents it. To maintain the mechanical elasticity of the muscle in order to assist and vascular dynamics of the circulation, it will help. In order to decrease or inhibit the pain, in order to maintain the patient's awareness about the movements, this will help. And to enhance the synovial movement, that is the fluid movement. Now, limitations of passive range of motion. Irrespective of its benefits, it has some limitations which needs to be understood. That is, if you give a range of motion exercise, it helps, that is passively, it helps only to increase the range of motion, not in any other means. That is, it does not improve or prevent the muscle atrophy, it does not increase the strength, it does not increase the endurance of that particular patient, and it does not help or assist in the level that active range of motion would help. That is, it does not assist active circulation to an extent which active range of motion would do to you. Whereas passive will only increase the range of motion of that particular joint structure. Whereas the indications of active range of motion and active assistive range of motion are slightly similar, where in active, the ability to contract the muscle the patient will have, that is to do actively, and to move a segment with or without assistance the patient can do. Whereas in case of active assistive, it is a weak musculature, but the patient is actively able to do the motion, may not be full, so they need assistance actively. Active range of motion will help in aerobic conditioning programs and in order to relieve the stress from sustained posture. That is, if we are maintaining for a posture for a certain period of time or for a long time, we can actually take some break and do some range of motion exercise. Whereas active range of motion exercises, when a segment is immobilized for a period of time, it might need a remembrance or a push that your movement is present and then we need to complete it. Now, looking into the goals of both active and active assistive range of motion, it has physiological benefits. It maintains the physiological elasticity of the tissues and the joints and contractility of the tissues. So it gives a sensory feedback to the patient that this is present or this range of motion is present in your body. It also stimulates the bone, it increases the circulation, it provides the coordination and motor skills of the functional activities, and it improves the joint tissue integrity. Now, the limitations are, it does not maintain or increase the strength. As I have already mentioned in the passive range of motion, that it only improves the range of motion. Active and active assistive also only improves the range of motion. It does not improve the strength, neither it maintains it. It does not develop the skill or coordination as well. Precautions that needs to be taken before you implement range of motion exercise into the therapeutic intervention. Range of motion should not be done when the motion is disruptive or it is breaking the process of the healing process. That is, it should enhance the healing process or it should help the way towards the healing, not cause a barrier to that particular healing process. So, in order to prevent it, judge or examine or assess the patient correctly so that you can give the range of motion exercise very apt way. Signs of too much or wrong motion include increase of pain and inflammation. Now, if you are not aligning or stabilizing the patient in a particular way that is supposed to be done while giving the range of motion exercise, you are doing a wrong motion or you are not helping your patient. So, that needs to be seen or cautioned enough. Whereas range of motion should not be done when the patient responds or the condition is life threatening. Now, in the conditions where the patient is in the death situation or in the situation where they are vitals are not stable, or in the situation where it's not safe enough to implement the range of motion exercise, do not give it just to improve the joint congruity. That is not important at that particular time. Whereas after the myocardial infarction or CABG surgeries or your coronary angioplasty, the active range of motion exercises of the upper extremity especially are limited, and the walking is also done only as tolerated. Do not overexert the patient and give lot of range of motion exercise. Now this depends upon patients to patient, it varies. So judge or assess the patient or examine the patient correctly and appropriately before you start implementing your range of motion exercise in the regimen. Now moving on to the practicals, that is your principles and procedures of applying this range of motion technique. So basically, as I have already mentioned, it is a plan to initiate, that is to examine priorly and then to initiate the movement. That is, first it acts as an assessment procedure as well, and then it acts as a treatment protocol as well. So examine the patient, evaluate the patient, and then plan how you will treat the patient. So examine and evaluate how much your patient's impairment is, what is the level of dependency in your patient and independency in your patient, what your patient is capable of doing. First you have to know that, and then determine what are the precautions needs to be taken in order to before giving the range of motion exercise, and then the prognosis how we will do, and then what is a plan of treatment to improve the range of motion to that particular patient. Now you have to first determine the ability of the patient to participate in the range of motion activity. That is, is the patient able enough to follow up or do the exercise which you are prescribing. You have to know that, that is the level of functional dependency or independency, and determine the amount of motion that can be safely applied to the patient, that is not blocking or hampering the process of healing. Then decide what patterns can best meet the goals. That is, if you are giving some particular kind of range of motion exercise, determine what pattern will improve the condition and get you a best goal out of it, and or meet your goal what is there in your patient. And then monitor the patient's general condition and responses during the treatment process, that is also during the examination process. So if a patient is not comfortable in the moment what you are doing, ask them their feedback and then continue or discontinue that particular exercise. Documentation is very important when you are doing it. So take a goniometer, measure the range of motion before and after the treatment as well. Communicate the findings what you are getting, that is their range of motion, how much is a degree to the patient, and then make them understand that this much is there or this much is not there. And then re-evaluate on daily basis whenever your patient comes, and then modify the intervention if it's necessary. If some treatment protocol is not working out well for your patient is not improving, then re-evaluate it, modify if necessary. Now moving on to the self-assisted range of motion techniques. Now self-care should begin as soon as the individual is able to understand and as soon as the patient is able to do some kind of movements by themselves. Now this has to be done in safe parameters as well. That is, your patient should learn how to do a particular movement by himself or herself as much as possible. Now after the surgery or traumatic injury, self-assisted range of motion exercise is used to protect the healing process as well. Now this is almost similar to active assistive, but then this is implemented by self. Now used to incorporate home exercises as well in the cases where your patient is in the home. So in order to perform exercises at home, if they are not preferring the physiotherapist to come to home and treat them, it is better that you prescribe them home exercise and they do it self. This can be given either as manual assistance or mechanical assistance as well when it's coming to self-assisted range of motion exercise. Now the guidelines for teaching it is, you have to first educate the patient the importance of movement or the value of motion. How important self-independency is, that is supposed to be known to the patient. If needed, you counsel the patient regarding its importance. Now teach the patient current body alignment and stabilization as well. While carrying out some of the exercises, it is understood that your patient has to be maintaining a neutral position, or there is a correct body alignment or stabilization position of the patient that has to be taught to your patient when it is prescribed at home. And observe the patient's performance. If any substitutes are done, if any accessory movements are done, ask them to avoid it, and if any unsafe motions are being done by the patient, ask them to avoid and correct them. So if equipment is used, we'll speak about the equipments in the slides coming up. Now all the hazards has to be eliminated. Now if you are switching on the continuous passive motion machine, you have to make sure that the main supply is functioning well, the machine is not rusted, or the velcro is not harming the patient. You have to position the patient correctly in that particular device, or the intensity, the speed, the duration, all of these buttons are working, the machine is working properly. Now these hazards has to be eliminated before you fix your patient with that particular motion. And then provide drawings if required, that will give them a visual cue, and then provide clear guidelines about how many repetitions needs to be supposed to be done, or how much is the frequency in which that movement is particularly needs to be done. Now some of the devices are wand exercise, that is also called as T-bar exercise. Now in this image, if you can observe, there is a wand or a T-bar in this particular patient which she is holding. Now basically this is used an active assistance, that is done by self, that is by the patient. Now if you can notice here, the patient herself is using a wand and then moving the shoulder into flexion, extension, adduction and abduction position. Now imagine if my hand or left hand is moving only from 0 to 60 degrees and the right hand is moving from 0 to 120 degrees of shoulder flexion. Now if I hold the wand in both of my hand, my right shoulder, which is active enough, will go up to 120 degrees. The left, as I told, it will move only to 60 degrees, but then because the wand is being held in the left hand, this will take it up to 120 degree, which will provide an active assistance that is also being done selfly. So this is called as self-assisted range of motion exercise. This is also referred to as T-bar exercise. This can be done with a double rod, with a cane, with a wooden stick which is easily available in the market as well as at home. Next one, we have wall climbing. This is also called as finger ladder exercise. Here basically, if you can see the image, the patient is moving in the wall, but then basically they have a finger ladder device which is having also the numbers 0 to 100 usually, which the patient needs to be standing position, and it improves the shoulder flexion, extension as well as abduction and adduction movement. So with the help of ladder, the patient will slowly progress and increase the range of motion of these particular physiological movements, and then the patient will get back into the position as well. Now these are very helpful in the cases as it gives a visual feedback as well, since numbers are there. So if on day 1 your patient is performing from 0 number to say about 30 number, the next day you can instruct your patient that do it up to 35 or 40. So the next day again up to 50. So this will increase the range of motion and also gives a visual feedback and encourage your patients to do better. Next one is the overhead pulley exercise. Now this is a basic device which can be set at home as well. In the therapeutic setup, it is designed to be a chair with the many pulleys and can be positioned for different actions, that is mainly for the upper extremity and lower extremity also. Upper extremity involves the shoulder flexion, extension, adduction, abduction. Even the lower limb involves hip adduction, abduction, flexion and extension. Now here the pulley basically helps in order to move the shoulder, as we can see the image. If the left shoulder, imagine, is being held by the barrel and the right wrist is holding the other barrel. If the right side is moving well, the left side is not moving so well, that needs assistance. Means because the right hand is moving up, the left hand obviously comes down because of the pulley, and when you pull from the right hand which is functioning, the left hand will obviously move up because of the pulley motion. So this is called as overhead pulley exercises. Next one, the last one, is the skateboard or the powder board exercise. Now you might have already seen how skateboard looks like how the skating is done. So it has some of the rollers, and this basically is used to train the upper extremity shoulder and lower extremity hip into flexion, extension as well as adduction, abduction. So these are moved, or sudden jerk is given to the skate roller or the powder board. So that will give a momentum to the skater board, because of which the shoulder moves into flexion, extension or adduction, abduction, and because of the momentum again it moves the hip into flexion, extension or adduction, abduction. Now This is a summary of the topic, that is range of motion and its types, that basically has the full motion possible, and the types are active, passive, active assistive, their indications, goals and the limitations, and the self-assisted range of motion, that is basically wand exercise or T-bar exercise, overhead pulley exercise, finger ladder exercise and skateboard or powder board exercise. These are the references, that is Caroline Kistner and an article. You can refer these. Thank you.